Imagine a high school sophomore, right? And they stay home on a Tuesday just to rest. Just one day.
Yeah, mental health day.
Exactly. They're overwhelmed, they're exhausted, and as a parent or an educator, you think you're doing the right thing by just letting them catch their breath.
Right. I mean, that's the standard advice nowadays.
It is. But by Thursday, that single, totally well-intentioned mental health day has quietly triggered this psychological mechanism that might keep them out of school for a month.
Wow. Yeah.
It just completely flips our usual logic right on its head. So welcome to today's deep dive. Our mission today is unpacking the incredibly complex mechanics of student mental health support.
And specifically, how the tools we use to help students can sometimes become, the very traps they fall into.
Right, because it's this landscape where the mechanics of good intentions often fail if you don't have the right infrastructure.
Oh, absolutely. We generally operate under this assumption that a break is universally beneficial, like rest is always good. But the sources we have today argue that treating rest as a universal cure-all is not just flawed.
It's actually clinically dangerous if misapplied.
Exactly.
So to guide us, we're looking at a stack of sources that tackle this from two distinct angles. On the operational side, we've got outcome data and clinical notes from MentalSpace School.
Which is a K-12 mental health support provider working within Georgia school districts.
Right. And alongside that data, we have this really fascinating clinical framework designed for parents and school counselors that dictates exactly how and when to utilize a mental health day.
Because the central paradox we're teasing apart today is this idea that giving a student a mental health day can actually backfire terribly.
Terribly. And the difference between a helpful reset and a harmful escape comes down entirely to the mechanisms of what happens during that day off.
Yeah, we so often get bogged down in the cultural debate of whether mental health days should be permitted or excused by school districts.
Like, is it valid or not?
Right, exactly. But the framework provided in these sources shifts the lens entirely. It argues the day itself is fundamentally neutral.
Neutral. Okay, let's unpack this. Because the action of staying home has no inherent therapeutic value, right?
None at all.
To really visualize what the source material is saying here, I think about taking a mental health day, like putting a bucket under a leaky pipe in your kitchen.
Okay, I like that.
Water is pouring out, things are chaotic, the floor is getting completely ruined. Sliding a bucket under that leak stops the immediate damage to your floor.
Right, you get to breathe and mop up the water.
Exactly.
Right.
But the bucket doesn't actually fix the plumbing.
No, of course not.
It just contains the crisis temporarily. Eventually, that bucket fills up. You still have to call a plumber, or the kitchen's going to flood anyway.
That captures the clinical perspective perfectly, actually. In the framework provided for counselors and parents, the mental health day is merely the bucket.
Just containment.
Right, it's a containment strategy. What surrounds that containment strategy is what actually dictates the outcome. The clinical framework breaks down the specific use cases where that pause actually functions as a help mechanism.
Okay, so when does the bucket actually help?
Well, first, it requires a state of acute overwhelm triggered by a discrete stressor.
Wait, discrete stressor meaning a specific identifiable event?
Yes. We're talking about a student processing a profound grief event, navigating a severe and sudden peer conflict.
Like a bad breakup or a fight.
Exactly. Or dealing with a massive life transition. In those moments of acute stress, the nervous system is flooded with cortisol.
Right.
It's genuinely dysregulated and needs a physical environment change to power down and basically stop the immediate fight or flight response.
So the system is overloaded and needs the circuit breaker flipped.
Yeah.
But the sources are very pointed about what has to happen while that circuit breaker is off, right?
Yeah.
Like the day must involve active processing.
Yes, that is crucial.
It cannot just be 8 hours of a student scrolling on a phone alone in their dark bedroom.
Because scrolling does not regulate a flooded nervous system, it merely numbs it.
Right, the dopamine loop.
Yeah, the dopamine loop of social media or video games serves as a distraction, but it doesn't process the discrete stressor that caused the overwhelm in the first place.
So they're just delaying the reaction.
Exactly. For the day to be clinically supportive, the framework dictates it must be paired with an active conversation with a parent, a counselor, or, a trusted adult.
Some sort of anchor.
Right. And crucially, that conversation must result in a concrete next step.
So it's not just, how are you feeling? It's, how are you feeling and what are we going to do at 9 a.m. tomorrow to address this?
Precisely. The follow-up touch point is the mechanism that bridges the student back to reality.
What does that look like in practice?
Well, it could be a scheduled check-in with the school counselor before first period the next morning.
Okay.
It could be a call to a pediatrician to discuss medication adjustments, or even a referral appointment with a licensed therapist. It's an episodic pause with a clear structural bridge back into the school environment.
Rather than a cliff edge where they just wake up the next day and have to face the music totally alone.
Right, exactly.
I hear the logic of that structure, but let me play devil's advocate for a second here.
Sure.
Because I think a lot of people listening, especially parents, who've seen their kids pushed to the absolute brink by academic pressure or social dynamics, they might push back here.
It's a tough topic.
It is. If a kid is crying at the breakfast table, if they are visibly vibrating with stress, my instinct is just to let them sleep.
Of course.
The system is overloaded. Let it cool down. Why does a single day of rest need to be so heavily engineered with, clinical touch points and referral pathways?
What's fascinating here is that instinct to simply let them sleep is exactly what the framework warns about on the harm side of the equation.
The harm side.
Yeah. When a student avoids a massive stressor, let's say a math test they are terrified of, or a cafeteria where they're being bullied, their brain registers an immediate massive hit of relief the second you say you can stay home.
Oh, wow.
And that relief acts as a biochemical reward.
So by letting them stay home without a clinical plan to address the math test or the bullying,
You are accidentally rewarding and reinforcing the anxiety loop.
that is wild.
The brain learns a very dangerous lesson. Avoidance equals safety.
That is a massive shift in perspective. You think you're providing rest, but neurologically, you are rewarding the avoidance behavior.
Precisely.
The underlying glitch in the game is actually getting worse while they're sitting safely on the couch.
The underlying issue grows in the dark. The sources detail clinically concerning use cases where these unmanaged mental health days become genuinely dangerous.
What are the warning signs? Like, what are schools looking for?
So school principals and counselors are trained to look for very specific red flags that indicate a student has entered that avoidance loop. The most prominent flag is when absences become patterned.
Oh, patterned absences, like if a student is consistently taking a mental health day every single Tuesday,
Right.
and Tuesday happens to be the day they have a double period of AP chemistry.
Then that is not a nervous system reset.
That is a strategic retreat from AP chemistry.
Exactly. It is avoidance behavior masking as self-care. The framework also highlights an escalating frequency as a major red flag.
So it starts small and snowballs.
Right. If a student takes 1 day in September, 2 in October, and 4 in November, the avoidance loop is strengthening.
It's gaining momentum.
Yeah. Another indicator is the presence of co-occurring somatic complaints.
Somatic meaning physical symptoms.
Yes, when psychological distress manifests as sudden, inexplicable migraines or stomach aches right before the school bus arrives, usually paired with social withdrawal.
But the real danger zone highlighted in the source material happens when these absences pile up and the adults in the room just kind of look the other way.
Yes.
If a student is out for their third mental health day of the month and no one initiates that follow-up conversation to ask what is actually going on, that avoidance loop calcifies.
Without that follow-up, these quietly patterned days off are frequently covering up an emerging case of what clinicians call school refusal.
School refusal, which sounds completely different from just playing hooky or skipping class to hang out with friends.
Oh, it is a fundamentally different psychological mechanism. Truancy or playing hooky is typically an oppositional behavior.
Right, breaking the rules for fun.
Yeah. But school refusal is a profound, often paralyzing, anxiety-driven inability to attend school. The student often wants to go to school, but physically and emotionally cannot cross the threshold.
That sounds terrifying for a kid.
It is. And a poorly managed mental health day one that functions purely as an escape valve without a plan can be the very first step into entrenched school refusal.
So the exact same action, staying home from school on a Tuesday, can be the intervention that saves a student's life during an acute crisis.
Or the catalyst that quietly accelerates a severe anxiety disorder.
The dividing line is entirely dependent on whether an adult steps in to map out a next step.
The outcome depends entirely on having a referral pathway. The day off is the bucket, the referral pathway is the plumber.
The plumber. Okay, so if the entire difference between a helpful reset and a harmful anxiety loop is a structured follow-up conversation,
Yeah.
How is a public high school counselor supposed to do that?
Well, that's the real problem.
I mean, we're talking about educational systems where a single counselor might have a caseload of 400 or 500 kids.
Easily.
They're dealing with college applications, scheduling conflicts, daily behavioral issues, asking them to personally manage the clinical referral pathway for every student who takes a mental health day seems mathematically impossible.
It is. That is the fundamental bottleneck in the public health system. Policy alone is insufficient.
Right.
Like, a school board can write a policy stating that mental health days are excused absences. But as the sources explicitly state, that policy lever produces opposite outcomes depending on the clinical infrastructure behind it.
A mental health day policy without a clinical infrastructure is inadvertently facilitating the harm framework.
Exactly. It's handing out buckets without ever calling a plumber.
Here's where it gets really interesting, because this brings us to the operational sources regarding MentalSpace School.
Yes, the Georgia provider.
Right. This bridges the gap between the theory of the clinical framework and the actual logistics of K-12 education. MentalSpace's entire operational model is designed to build that referral pathway directly into partner districts in Georgia, so the school counselors aren't functioning as a solo act.
If we connect this to the bigger picture, they provide the infrastructure that turns a policy into a clinical intervention.
Right.
And the mechanics of how they do this are highly specific. It isn't a passive resource like, a poster with a 1-800 hotline in the hallway.
Call this number if you're sad.
Right, which never works. They provide dedicated therapist teams that are integrated directly with the school's own counseling staff.
I want to dig into how that actually works mechanically, because based on these notes, MentalSpace provides same-day teletherapy access.
Yes.
If a student is in the middle of an acute overwhelm event, say they have a massive panic attack at the cafeteria, the school counselor can bring them into their office, and rather than putting them on a 6-week waiting list for a community therapist,
Which is the standard reality in most districts.
right, instead of that, they can initiate a secure teletherapy session with a MentalSpace clinician right then and there.
And the immediacy of that intervention intercepts the avoidance loop we discussed earlier.
Because you're catching it in the moment.
Exactly. If a student is in crisis, an appointment 3 weeks from Thursday is totally useless.
Right.
The nervous system needs regulation in the moment.
Right.
Furthermore, by integrating with the school's existing team, they close the communication loop.
How so?
Well, when a student returns from a mental health day pause, the next step is already activated. The school counselor knows the treatment plan, the MentalSpace therapist is conducting the sessions, and the student's teachers can be advised on necessary academic accommodations.
So everybody is on the same page.
Yeah.
And the sources show they handle a massive umbrella of services beyond just individual therapy.
Oh, yeah, it's comprehensive.
They're running crisis intervention, suicide and violence prevention protocols, family counseling, and even staff wellness programs.
Which is vital.
Because you can't have a functional student support system if the educators themselves are burning out and dysregulated.
Right. It approaches the school as an entire ecosystem rather than just a collection of individual students. But having a comprehensive clinical ecosystem is only effective if the students can actually enter it.
The barriers to entry.
Always the hardest part.
So what does this all mean for accessibility? Because the sources mention a looming deadline for something called HB 268 compliance hitting Georgia schools.
Right, July of 2026.
And it is currently May 2026.
Right.
So what exactly is that mandate forcing these districts to do mechanically?
HB 268 acts as a legislative forcing function. It requires school districts to have concrete, operational mental health action plans and protocols in place.
So no more pretending the problem doesn't exist.
Exactly. They can no longer just point to a community health clinic down the street. They have to demonstrate internal clinical infrastructure. MentalSpace provides the specific compliance support for that July deadline.
Got it.
But the legislative mandate only solves the school's administrative problem. The operational notes detail how MentalSpace removes the barriers for the actual families.
And the first barrier is always trust and cultural competency, right?
Always.
A student sitting in a counselor's office needs to feel understood by the clinician on the other side of the screen. The sources emphasize that their therapists are licensed, diverse, and culturally competent.
Which builds immediate rapport.
Right. They also ensure the entire platform is HIPAA and FERPA compliant.
That's a huge deal. It means medical records and educational records are communicating securely without violating student privacy.
The privacy standards are foundational. but I feel like the most significant friction point in any healthcare pathway is financial.
100%. If a referral pathway leads to a bill a family cannot pay, the pathway is broken. It's
100%.
useless.
But the insurance integration in these sources is incredibly broad. They accept all the major commercial carriers, BCBS, Cigna, Aetna, UHC, Humana, Peach State, CareSource, Amerigroup.
Yeah, that covers a lot of ground.
But the linchpin detail in these operational notes is their Medicaid integration. Medicaid coverage through MentalSpace is $0.
Wow.
No copay, no hidden fees, nothing.
And removing that specific financial barrier transforms mental health care from a luxury service into an accessible public utility.
Which is a game changer.
It really is. Consider the vulnerable populations in these school districts. If a parent is working 2 hourly jobs and their child is tumbling into school refusal, a $50 therapy copay every week is an impossible hurdle.
It's just not going to happen.
Right. A $0 Medicaid pathway means the clinical infrastructure can operate based on medical need rather than financial capacity.
And the outcome data proves that when you remove the friction and provide the pathway, the entire system corrects itself.
The numbers don't lie.
No, they don't. The source data from MentalSpace School ties this all back to our discussion on the dangers of school refusal. Because they're actively providing the follow-up, they report an 89% improved attendance rate among the students utilizing the service.
That metric is the ultimate validation of the clinical framework right there. An 89% improvement in attendance means they are successfully intercepting the avoidance loop.
It's working.
They're stopping those neutral days off from calcifying into entrenched school refusal.
They're fixing the glitch in the game instead of just pausing it forever. And the data also shows a 92% reduction in anxiety symptoms and an 85% family satisfaction rate.
I mean, those aren't incremental improvements.
No.
Those are system-level transformations that alter the trajectory of a student's life.
It really proves the core thesis of the sources. When you pair the regulatory pause of a mental health day with an active clinical plan, the outcomes shift from harm to profound help.
It really brings the entire complex mechanism into focus.
It does. Which brings us back to you, listening to this deep dive. Whether you are an educator trying to figure out how to handle rising absenteeism in your district, or a parent navigating your own child's stress and trying to decide if letting them sleep in today is the right move.
Or just someone interested in how public health infrastructure actually functions in the real world.
Exactly. The core lesson here is profound. Well-intended policies require operational plumbing to succeed. A mental health day without a plan is just a bucket catching a leak.
This raises an important question, though, one that extends far beyond K-12 education and into adult psychology.
Oh, absolutely.
Think about your own life, your own workplace, and your own habits. We frequently take adult mental health days. We call in sick when we're completely burned out, overwhelmed by a project, or avoiding a difficult conversation with a boss.
Guilty is charged.
Right. But based on the framework we explored today, are your personal days off functioning as a true regulatory pause? Do you have a follow-up plan to address the root cause of your burnout?
Or are your mental health days just an unaddressed pattern of workplace refusal?
Exactly. Functioning merely as an escape loop that reinforces your own anxiety.
That is a terrifyingly accurate mirror to hold up. Are we regulating our nervous systems, or are we just practicing avoidance?
It's definitely something to think about.
Thank you for joining us on this deep dive into these sources. We hope it gave you a new lens to view the mechanics of mental health, and we encourage you to keep asking the hard questions about the systems, the safety nets, and the avoidance loops around you. Until next time.